lying between the lateral incisor and the first premolar. And occlusion is against upper lateral and canine. Actually, the lower is always related to the corresponding upper and the previous ones. And the lower and upper is always related to the corresponding lower and the next one. So our lower canine is related with the upper canine and the lateral one. Crown length, you see here, crown length is 11 millimeter, root length is 16 millimeter. All crown is little bit longer, but root length is little bit smaller. Mesodistal dimension is 7 millimeter. Mesodistal dimension, the cervix is 5.5. Labiolingual at the crest of curvature 7.5, in the cervix 7. Mesial curve of cervix lingual is 2.5, and distal curvature of line is 1 millimeter. So it is almost on the distal side, it is almost a straight, very minimum curving. Number of surfaces, it has five surfaces actually. Labial, lingual, mesial, distal, and incisal surface or incisal tip with the cusp. It has four surfaces and incisal aspect with a cusp. It has only one root. Usually it is a single-rooted tooth. So central incisor, lateral incisor, and canine, all this tooth is single-rooted. Again, if you go to the lower jaw, the lower 4 and lower 5 is also single-rooted. But in case of upper jaw, among the two premolar, usually the first premolar is two-rooted, second premolar is one-rooted. So among 1, 2, 3, 4, 5, central incisor, lateral incisor, canine, first premolar and second premolar. Among these 5 tooth, you will find only one tooth is two-rooted. That is upper first premolar. Bagi all tooth, they are single rooted. Okay, remember this basic principle. Otherwise, because it is necessary for us to remember how many roots we have in the tooth. Upper molar, if you go for the upper molar, all upper molar is three rooted, all lower molar is two rooted. Bas. The crown is narrow mesodistal. You see, if we compare the maxillary canine with the mandibular canine, then we will find that maxillary canine mesodistally is little bit wider than the mandibular canine. And mandibular canine is little bit longer cervico-incisally in this dimension than the maxillary canine. So mandibular canine looks little bit thinner and longer. The contact areas are more incisally located. You see, the contact areas are more incisally located means the cusp tip is not that much sharp. Here, the cusp tip is very sharp, and that is why the cuspal ridges are very long in comparison to mandibular canine. So it looks like a very sharp tooth. But in case of mandibular canine, you can check with your mouth in the mirror that the lower canine is not that much pointed. It is the contact points are a little bit more incisally located. The cusp tip is slightly lingual to the apex. As usual, the all lower tooth is little bit lingually tipped. So that the upper tooth can cover the lower tooth buccally. The crown appears longer. So the lower mandibular canine is little bit longer and less wide. Upper maxillary canine is more wide and little bit less longer than the mandibular canine. This is one measurement. The elevations and depressions are less developed. In case of lower canine, all the elevations and depressions are little bit less developed. So what are the elevations? Cervical ridge is one elevation, labial ridge is one elevation, lingual side, cingulum is one elevation, and lingual ridge is one elevation. And marginal ridges are another elevation. So all these elevations are little bit less prominent in comparison to the maxillary canine. Outline of the root, in case of maxillary canine, long, slender, conical with distal curvature, a very strong root, right? Long, straight, thick, conical. Conical is like gradually tapering like the central incisor with a little bit distal curvature. But in case of mandibular canine, it's a little bit shorter with pointed apex, very thin apex. Okay, the apex is very thin and pointed. Of course, it is also distally curved. So labial surface, if we make a comparison between the labial surfaces, you see the geometric outline for both the tooth is trapezoid. So it is similar. There is a similar thing. Contact area for maxillary canine, the mesial is between the mesial and sagittal one third, distal is in the middle third, right? Little bit cervical. In case of mandibular canine, at the incisal one third, the mesial is at the incisal one third, and distal is between the middle and the incisal one third. Okay, so not at the junction, but between the middle and the incisal one third, little bit more incisal. So maxillary canine having the contact point, which is a little bit more cervical, or you can say mandibular canine has the contact point which is more incisal in comparison to the maxillary canine. The mesial outline for maxillary canine, we told you that the mesial outline is from the cervix, it is convex till the contact area, then concave to the cusp tip, right? But this mesial outline in case of mandibular canine is straight till the contact area, then concave to the cusp tip. So what is the difference between them? Maxillary canine, first convex, then concave to the tip. And mandibular canine, first straight, then concave to the tip. Distal outline, both is similar, same. Concave till the contact area, then convex to the cusp tip. This is for the tooth, both the tooth, this is similar. The cusp slope, similar. Mesial slope is shorter than the distal slope. Okay, so because remember, both the tooth, the cuspal tip is little bit mesially inclined. That's why mesial slope is short and distal slope is little bit big. Cervical line in both the tooth, it is convex towards the root. So this is the comparison, direct comparison with the maxillary and the mandibular canine. So if we remember what is the difference, the contact area is a little bit different and mesial outline is a little bit different. Otherwise, all these three is similar. Well-developed middle lobe with two developmental groups, labial ridge. Okay, labial ridge in case of maxillary canine, very well developed. You can see the ridge nicely, and on the both side of the ridge there is little depression. As I told you before, that there are three lobes making the labial surface. The middle lobe is well developed, engorged, so it is seen as a cusp, it is seen as a labial ridge, and it is seen as a lingual ridge. And the joining between the middle lobe and the mesial lobe is little bit depressed, and joint line between the middle lobe and the distal lobe is also a little bit depressed. This is for maxillary canine. Mandibular canine, everything is similar but little bit less prominent. So labial ridge also less prominent, cusp is little bit less prominent, lingual ridge is little bit less prominent, everything is little bit less prominent. Even with the developmental groups are not that much deep. Okay, cervical third, both is convex cervical ridge. They both have cervical ridge convex, and root, the root taper to a pointed end, distally curved apex. Okay, so root also looks almost similar, but I think the mandibular canine is having a little bit more pointed than the maxillary canine. Lingual aspect you see here, what are there? The same as upper three, except what was in the upper three, you see there is cingulum, cervical one third. Okay, there is cuspal ridge. This is distal cuspal ridge, little bit longer than the mesial cuspal ridge, little bit shorter. Then we have marginal ridges. Okay, we have marginal ridges. The distal marginal ridge is long, and mesial marginal ridge is long, and distal marginal ridge is short. Then we have lingual ridge. This lingual, you see, this lingual ridge is not complete. This is starting from the cusp tip and run up to the maximum half of the lingual side. So lingual ridge is not that much prominent and is not complete. This is one thing. As a result, the lingual fossa, there were two fossa in the maxillary canine because the lingual ridge was very prominent. But here, the lingual ridge is, a lingual fossa is a continuous single fossa, which is little bit U-shaped. Okay. So this is one difference, that the lingual ridge is incomplete and less developed. As a result, the lingual fossa is a single fossa and little bit U-shaped. The elevations are poorly developed. All the elevations are poorly developed, not that much but present, but not that much developed. It has only one lingual fossa because the lingual ridge is incomplete. Okay, so this is the main striking point between the lingual surface of the maxillary canine and the mandibular canine. 1 minute. Everybody is there, so I take another attendance. Same, similar with the labial aspect, concave, convex, and concave, and for mandibular canine, straight and concave, convex, but then straight, but then concave and convex. So lingual convergence in maxillary canine, lingual convergence is present, but in comparison to the mandibular canine, maxillary canine is less and mandibular canine is more. So lingually, little bit more thin mandibular canine. Cingulum and marginal ridges well developed in case of maxillary canine, but little bit less developed in case of mandibular canine. Lingual ridge prominent from the cusp tip till the cingulum, but in case of mandibular canine, it is restricted to the incisal third one. It is incomplete. Okay, so lingual ridge is incomplete. So lingual fossa, what is there? In case of maxillary canine, the lingual fossa is divided into two fossa. So we got two lingual fossae, and in case of mandibular canine, one fossa which is little bit U-shaped. The mesial aspect, you see the geometric outline is triangular as usual from all the anterior tooth. The mesial aspect is, distal aspect or mesial aspect is triangular in shape from geometric point of view. And base is at the cervical line and tip is at the apex is at the incisal tip. The cusp tip may be on a line that bisects the center of the root or slightly lingual to it. Cusp tip, in case of maxillary canine, it is straight or labially position. In case of mandibular, it is straight or lingually prominent, inclined. Outline, the labial outline you see is slightly convex with greatest convexity at the cervical 1/3, as usual. The lingual outline is convex at the cervical 1/3, that is cingulum, then concave at the middle third and convex at the incisal third. In case of maxillary canine, the middle concavity cannot be seen due to increased or prominent lingual ridge, so it becomes a little bit straight. But in case of mandibular canine, it looks like a incisor. Why? Because the lingual ridge is not that much prominent and it is incomplete. So it is from the proximal side, it is seen like an incisor tooth, convex, concave, convex. The mesial cervical line is convex incisally, of course. You see here the mesial cervical line. This is the mesial cervical line is convex, and the highest point in the mesial surface is the contact point. It is near the incisal tip or cuspal tip. The mesial surface is convex with the maximum convexity at the incisal 1/3. Okay, this is the contact area. The root is broad and tapered to blunt apex. You see the root is very broad and tapered, gradual tapering to the blunt apex. It has a mesial developmental depression. This red line, I'm sorry, this red line, there is a mesial developmental depression where depression is present on both sides, mesial and distal. But what is happening? Sometimes the depression is so deep on the both sides that the apical area divides into two parts and looks like two root. Okay, we'll tell about this later. To mesial side, if you compare with the maxillary 3 and mandibular 3, the geometric outline is triangular for both of them. Labial outline convex, the crest of curvature of the cervical third. Okay, the lingual is less curved, similar but less curved. Lingual outline convex, straight convex, but in case of mandibular convex, less concave and less convex. Cusp tip labial to the bisecting line. Cusp tip is labial to the bisecting line, and in case of mandibular, it is lingual to the bisecting line or maybe straight. So both the cases straight or labial or mandibular, straight or lingual. Cervical line convex incisally, both the tooth, and root is broad with pronounced developmental depression for both the tooth. Distal aspect, distal marginal ridge is more pronounced. This is distal marginal ridge. You see, this is distal marginal ridge is a little bit more pronounced. and cervical line is less curved. You see here, the cervical line is only 1 millimeter. It is a little bit less curved. Distal contact area is more cervical. Mesial was here at the incisal 1/3, and the distal is little bit more cervical. Developmental depressions are more pronounced. This is the developmental depression on the root is little bit more deep and more pronounced. So if we compare, contact area is more cervical. This is true for both the tooth. Cervical line is less convex. This is true for the both the tooth, and root development is more developed. Depression, developmental depression is more developed, more deep in both the tooth. Occlusal aspect. See the red line. Red line is the mesodistal dimension. The blue line is the blue line is the mesodistal dimension, and red line is the labiolingual dimension. The labiolingual diameter is greater than the mesodistal diameter, but in less proportion. What does it mean? Both the canine, remember, both the canine, the labiolingual dimension is bigger than the mesodistal dimension, upper and lower. But in case of upper, the labiolingual and mesodistal dimension comparison is, for example, little bit 1:1.5, for example. If this is 1.5, this is 1. But in case of mandibular canine, if this is 1.2, this is 1. You understand the ratio between the labiolingual dimension and the mesodistal dimension is little bit less in case of mandibular canine. The cusp tip is slightly lingual and mesial to the center of the crown. Cusp tip. This is the cusp tip. Actually, it should be here. Actually, the cusp tip. This is a one dimension. This is one dimension, and this cusp tip actually is little bit mesial and lingual. This is our cusp tip. So if you see from here, yeah. The cusp tip is slightly lingual and mesial to the center of the crown. And mesial cusp ridge inclines lingually. Mesial cusp ridge is little bit lingually inclined. So if we go for the comparison incisal diameter, labiolingual is more than mesodistal, same in the mandibular canine, but in less proportion. Cusp tip, labial and mesial to the crown center, and lingual and mesial to the crown center. Okay, and the ridges and fossa is well developed, but in case of mandibular canine is less developed. Now come to the pulp cavity. The guys, sorry, do you have any question up to this? Anything need to clarify? Please respond. Yes or no?
No.
No. Okay. Pulp cavity is similar to the maxillary canine but smaller. How was maxillary canine? Maxillary canine was, we are telling that the crown pulp cavity is bigger in the crown, and gradually it is also bigger up to the half of the root, and then it is gradually tapering, right? This is our maxillary canine, for example. This is the tip of the crown from the mesodistal dimension. It is bigger in the crown, and then in the root, also half of the root, it is big as the crown, and then gradually tapering down. But here you see, this is bigger, of course bigger, but when it is coming to the apical area, it is divided into two canals. This is very normal in case of mandibular canine, that either they are divided and ends as two apical foramen, two canine, or they are divided and coming to join again at the apical area to become one canal. So both is difficult. Lower canine, doing root canal treatment for the lower canine is very difficult. This is why. May have one or two root canals, labial and lingual, joined at the apex or remain separate in if bifurcated. So this is very normal, but of course you will get many single canals, but there is chances that 50% cases you will get the canals like this, splitted either into two apex or splitted and then again joined into single apex. Why this is happening? Because that you see here, most of the cases, you see this is single, here single, but coming at the apex two parts. two parts, single, apex, two parts. This is the basically scenario. The other scenario is that divide into two and remaining as two. Variation and anomalies, crown form, this is the variation. Is the crown form is not greatly variable. Crown form is similar, but irregular curved roots are occasionally seen, and bifurcated roots with labial and lingual branches are also possible. You see, the developmental depression is so big that the apical area of the root is divided into two parts. Actually, it was a single root. It was a single root like this, but the depression on the mesial and distal surface is so deep that it has divided the roots in the apical area into two parts. And canal, so the canal is also two canals. So sometimes there are two canal with two apical foramen. Sometimes it is two canal with one apical foramen. So you will find almost two canal in many of the cases. You see here the incisal, this is the contact point. The contact point is more incisal. You see here, tip of the cusp is very less prominent, very less prominent. And you see, this is one cuspal ridge, this is one cuspal ridge. Maybe this is mesial, this is distal. Distal is a little bit more cervical, mesial is a little bit more mesial. So this is our shape and size, abnormalities and variations. Okay. So this is the some quiz-like slides. So enumerate the names of the following elevations and depression. For example, you will see one by one. What is this? This is, we can see from the occlusal side, this is cingulum. Okay, this is mesial marginal ridge. Sorry, distal marginal ridge, smaller. Then this is mesial marginal ridge. So mesial, distal marginal ridge is smaller. Why? Because the distal cuspal ridge is long. Because this distal cuspal ridge is long, this distal marginal ridge is short. This is tip of the cusp. This is distal slope, cuspal slope or cuspal ridge. This is mesial cuspal slope or cuspal ridge. This is lingual fossa. This is lingual ridge. Okay. This is a lingual ridge, which is complete. This is cervical ridge, which is being seen from the tip of the cusp. And this is what? Labial ridge, which is seen from the tip. So what tooth it is? In case of total, if you got the scenario, what is this tooth? Maxillary or mandibular? Tell me.
What's the question?
Maxillary.
Maxillary. Thank you very much. This is maxillary. Why? Because you see the complete elevation of the lingual ridge and dividing the fossas into two parts. This is the main difference in the lingual side. Otherwise, you cannot tell the other things. Other things are similar but less developed. You cannot see from the incisal region. But what you see, the complete lingual ridge and two fossa. This is our tooth, maxillary canine. The names of the following elevations you see here in the mandibular canine. This is cingulum. This is mesial marginal ridge, distal marginal ridge. Then this is mesial cuspal ridge or cuspal edge. This is distal cuspal ridge. This is a little bit bigger. Lingual ridge, which is incomplete, nearer to the incisal tip. And this is lingual fossa, which is a little bit U-shaped. Single fossa, but U-shaped fossa. This is lower canine. So lower canine and upper canine, this is the lingual surface of the lower canine. You see here, cingulum, mesial marginal ridge, distal marginal ridge. Then you got the cusp tip. Then you got the cuspal ridge, distal cuspal slope or mesial cuspal slope. Then the incomplete lingual ridge, then cervical ridge, then this labial ridge, and finally the lingual fossa is a single lingual fossa, which is a little bit U-shaped. So we got all these things here, following elevations and depressions. Again, the maxillary canine. Cingulum, mesial marginal ridge, distal marginal ridge, mesial cuspal ridge, distal cuspal ridge, or incisal ridge, whatever you say. This is lingual ridge, lingual fossa, mesial lingual, distal lingual fossa. Yeah. This is the surface of which surface? Labial or lingual?
left,
Labial. Very good. Labial surface. And for which tooth?
upper, upper mark.
Yeah, for upper tooth. Sorry. Okay. It erupts at the age of when it erupts?
3 to 4 months.
No, no. Eruption is different. 3 to 4 months is starting the development of the animal organ. Remember, the mandibular canine is coming is from 10 to 11 or 9 to 11. Maxillary canine is coming 10 to 11 or 11 to 12. Okay. The mesial cervical area is located is cervical 1/3, while the distal, mesial contact area is located at the where? Junction of the incisal 1/3 and middle 1/3. Distal contact area is located at the middle of the middle third. Elevation on the surface are cervical ridge and labial ridge, right?
Singular.
Yeah, cervical ridge and labial ridge. Depressions are two depression on the both sides of the labial ridge, indicating the joining of the three lobes. Okay, thank you very much. So, if you have any questions, do you have any questions?
Yes.
Yes, doctor.
Please.
How the canine has two roots?
How? Okay. I told you that the developmental depression, for example, you just imagine this is a single root. This is a single root like this, okay? But the developmental depression, we told you that there is developmental depression here. For example, this developmental depression, if it is too deep, in this apical area, what is happening? This depression is so deep that it is communicating on the both side and splitting the single root into two parts. One is labial, one is lingual. Do you understand? This is how the canine sometimes may have two roots. The root will be positioned at lingual part and labial part. Actually, it is not two root. I told you this is a single root, but split by the deep developmental depression. Okay.
Okay, doctor. Okay.
Okay. Shall any more?
Doctor, is it normal or considered as disease?
No, it is considered as an deviation, abnormalities or variation.
Yeah, it isn't not normal.
It is not normal. You will find this variation in few cases, but two canal you will find it is variation, but you will get two canal in many cases. Even they are not bifurcated, the canals are divided into two parts in many cases. Of course, that is also a variation. Okay.
Okay. Can you go to the slide about distal aspect?
About
Distal aspect.
distal aspect. Okay. Lingual, mesial, distal. Yeah, distal aspect. Yes.
What is the DMR?
A distal marginal ridge.
Okay.
Distal marginal ridge. This is distal marginal ridge. Actually, I should write here for your.
Okay, doctor, what is the principle you say at the first selection?
What?
I think upper two molars and two lower molars has two roots. I don't.
Yeah, I told you that. If you think about the anterior tooth, the first three is anterior. One, two, three. Central incisor, lateral incisor, and canine. These are anterior tooth. Premolar is a transforming tooth, but considered as a posterior tooth. First premolar, second premolar is posterior, and the most posterior is first molar, second molar, third molar. So among the first five tooth, central incisor, lateral incisor, canine, first premolar and second premolar. In case of lower jaw, all the tooth are single rooted by general virtue. In lower jaw, I mean mandible, all the first five tooth is single rooted. Clear? In case of upper jaw, among these five tooth, only first premolar is two rooted. First premolar is two rooted. So if I ask you anytime, upper canine how many root, upper first premolar how many root, lower first premolar how many root, you will consider like this. All lower tooth until the second premolar is single rooted. All upper tooth until the second premolar is single rooted, with one exception. Exception is first premolar. First premolar has two root. Okay. Now, if you think about the rest of the tooth in the upper jaw and the lower jaw, the first, second, and third molar in the upper jaw, first, second, and third molar in the lower jaw. Upper jaw, all the first, second, and third molar is having three root. Okay. Lower jaw, all the first, second, and third molar is having two root. Okay. Did you get a clear idea about the root of the tooth? Yes. Think like this. Yeah.
Except first premolar.
Only first premolar is two rooted among the first five.
Yes,
Okay.
first premolar. And the lower
Lower is single. Lower
lower
premolar, both the lower premolar is single rooted.
teeth are single root.
Yeah.
Except the first small.
Upper first premolar.
Lower.
Lower, all the lower is single rooted.
Except
Only
the,
molars are two rooted.
yes.
Yes. Any more?